sir. My name is Sevenido Ayamelo. I am your student nurse for today. May I know what is your name,
My name is June Ryan Binaan.
your age,
I'm 9 years old.
and your birthday?
My birthday is October 2, 2003.
Okay. We're here for you to assess your neurological system or the cranial nerves. We are conducting this type of assessment for us to know if they are intact. Okay? And I am going to make you some instruction, and I want you to follow it. Okay, sir. Before we conduct our assessment, I have some few questions I want you to ask. Okay. First, do you have any memory loss,
None so far.
head injury, stroke?
None.
Do you smoke?
No.
Okay. Now, I'm going to ask you some questions, and it is regarded. It is regards the mental state. Okay.
Okay.
Do you know what is the month of today?
Month?
Yes, month.
May?
Okay. Do you know who is the current president of the
Uh,
Philippines?
Yes, it's Bongbong Marcos.
Do you know who I am?
Yes, you are JB yung ano.
Okay. Okay, now I am sure that you are oriented, place, time, and situation. Okay, now I have some few questions and is related to screening for suicidal thoughts and depressions, and I have some few questions I want you to answer. Okay. Do you have ever felt feel lonely or sad and happy?
No.
Do you have felt want to hurt yourself?
No.
Something like that? Okay, that's great. And now we will proceed to our assessment, which is the cranial nerves. First, the cranial nerve number 1, which is the olfactory. And its function for smelling. Okay, sir? I'm going to blindfold you first. Okay. I want you to tell me if it's a good or stink smell. Okay.
It smells good.
Okay. And that's for the cranial number 1. And the cranial nerve number 2 is the optic, which is the eye activity test. Okay. I want you to cover the other eye. And I want you to tell me that if you can see my fingers. Okay.
Okay. I see it. I see it. I see it. I see it.
Okay, the other side.
I see it. I see it. I see it. I see it.
Okay. That indicates that your cranial nerve number 2, which is the optic nerve, is intact. Now the cranial number 3, 4, and 6, okay, which is the 6th cardinal position of gaze. Okay, I want you to follow this pen light. Okay. Okay. That's right. Now for your accommodating light reactions. Okay. I want you to face here. Okay. Okay, if the result of your assessment in your eye is parallel, which is pupils are equal, round, reactive to light, and accommodation. Now for your cranial nerve number 5, which is the trigeminal. Okay. responsible for sensation. First, I want you to smile, frown. Okay, I want you to close your eyes, and I want to say now if you feel any sensation. Okay.
Okay. No. 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 No.
Okay. The next is you can open your eyes. The next is I want you to hurt your feet. Yeah. Okay. We must feel okay. That's good. It indicates normal and intact. Okay, the next is the cranial nerve number 7, which is the facial nerve. Okay, again. Okay, I want you to smile again, frown, close your eyes. Okay, um, your eyebrows up. Okay, okay, you can open your eyes. Okay, it indicates that your assessment in your facial nerve which is the cranial nerve number 7, is intact. Okay, the next one is the cranial nerve number 8, which is the vestibulocochlear. It is responsible for hearing. Okay, this is called the whisper test, and I want you to repeat what I have said. Okay.
Okay. Linear. Yellow. Yellow.
Okay, your cranial nerve number 8, which is the vestibulocochlear, is intact. The next one is the cranial nerve number 9 and 10. Okay, now I want you to say that's right. Okay, now I see your uvula and the soft valley goes up as you say and that indicates normal. And the next one is the cranial nerve number 11, which is the accessory or the spine nerve. Okay, I want you to turn against my palm. The other side. Okay, shrug up. Okay, your cranial nerve number 11, which is the accessory nerve, is intact. And the lastly is the cranial nerve number 12, which is the hypoglossal. I want you to stick out your tongue. Okay, that's okay. The next is we will assess your muscle strength, and I want you to hold your arms like this, up, straight, close your eyes. Okay, and I want you to squeeze my fingers as hard as you can. Okay, that's great. Okay, now we will proceed to your lower extremities. Okay, I want you to lay down here in a supine position. Okay. Okay, for your assessment in your lower extremities, okay, I want you to pull up your leg. Okay, down the other side. Okay, down. And I will push this one. Okay, pull up against my hands. That's great. Okay, sir, you can go back to your position. Okay. Now, we will proceed to your coordination. Okay. I want you to touch your fingers like this. Okay. That's right. And I want you to touch your nose and touch my finger, okay? Okay. And for your sharp and dull discrimination, okay? You have some paper clip here, okay? You can close your eyes, okay? I want you to tell me if this is sharp or dull, okay?
Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. 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 Dull. Sharp. Dull.
Okay. And now, we will proceed to your Romberg test, and I want you to stand up, sir. Just relax. Put your hands your side and close your eyes. Okay. Okay, sir. Can you walk through over there? Okay. Turn back. Okay. You can sit down, sir. Um, Next, we are done the coordination test. And for your reflexes, okay, sir, we'll find your tendons. First, we need to palpate where is your tendon. Here. Okay, that's great. The other side. Okay. Now, your reflexes in your patellar area, okay? The other side. Again. Okay. Okay, for your sensation test, I will blindfold you again, sir. Tell me if you sense cold water or hot, okay? Put your hands up, okay?
It's cold. It's cold. Hot. Cold.
Okay. Okay, sir, now we're done to your assessment for your cranial nerves, muscle strength, coordination, and sharp and dull discrimination. And here are your results. And based on your assessment, um, we didn't see any signs of abnormalities in your assessments, okay? And it indicates that your cranial nerves are intact, okay, sir? And that concludes for our neurological assessment. Thank you for your participation.
Thank you, sir.